Hello, my name is Dr. Jacob Curtis. I'm a physician at Grand Peaks Medical in Rexburg and St. Anthony, Idaho. I'm a family physician and also I have an additional background in obstetrics. The purpose of this patient educational video is to share with you and serve as perhaps a reminder of different types of contraceptive options available to you. This disclaimer slide just reminds you that this information is not to take place of content that you may have received or a conversation that you've had previously with a healthcare provider. If you're having concerning symptoms, you're instructed to follow up with your healthcare provider and or if the symptoms are serious, to go to your local emergency department. What exactly is contraception? Oftentimes when I'm having conversations in the office with patients and we use the word contraception, birth control, many synonymously think of it as birth control pills alone. The reality is there are many other options, and the purpose of this, the few moments that we have together, is to review the options available to you. And so the purpose is to delay pregnancy until the individual and or the couple in the relationship are ready to conceive. There are three major categories in order of effectiveness: scheduled abstinence, also known as natural family planning, barrier protection, and hormonal. There are also some other mechanisms of action that we'll outline that don't involve hormones, but are more than barrier protection alone. Starting with natural family planning, the joke in obstetrics is, what do you call a couple who engages in natural family planning? And the answer is parents. The reason for that is it's oftentimes, for many couples, not always the most effective. Older literature suggests it may be as effective as 80%, but in clinical practice, many of those who provide obstetrics and women's healthcare see the incidence of unplanned pregnancy much higher than that. And so the rationale is, if a woman is having regular menstrual cycles, then she would predict that if she's having a 28-day cycle, she might be anticipated to be ovulating and be most fertile halfway through at day 14. So abstain from relations 3 to 5 days prior and afterwards. But again, not always the most reliable, because we're not, unless you're monitoring, may not exactly be sure of when ovulation might occur. Barrier protection is also a very popular option. This is referring to male or female condoms, male condoms being by far the most common, and historically also available were the cervical cap or the diaphragm, although less popular today because of some potential side effects of infection. What are the pros and cons or the advantages? Very easy to obtain, quite inexpensive compared to some of the other options out there, no hormones involved, and they can also, and this is perhaps the most important, especially for those individuals who are in the dating years and may not be in mutual monogamous relationships at this point in their life, that it can help to prevent the risk significantly of sexually transmitted infections. Many of the other options we'll cover, if not most, do not provide protection against STIs, and so that's where barrier protection in combination with other things is often advised. What are the risks? It can affect spontaneity of that intimate experience that a couple may be engaged in. It can also not always be most reliable. They can break, they can slip, they can leak. And so that's the, I guess, the holdup. It's a smaller subset of the population, but there can be latex allergies as well as spermicidal intolerance that can cause kind of minor skin reactions. Birth control pills, the list is extensive of the different types of birth control pills. They basically fall into two categories: a combination, which is a combination of estrogen and progesterone in varying amounts, either kind of low, moderate, or high dose. Sometimes they'll change the amounts of estrogen, progesterone consistent with the point in your cycle. There's what we refer to as monophasic and triphasic that refer to that. And the other form of birth control pill is progesterone only. Oftentimes not as effective at preventing ovulation when used alone, but we use it for a select subset of the population, those who might be more hormonally sensitive, smaller, younger individuals, and also those who are breastfeeding. Why? It's not that estrogen is bad, but it can decrease milk supply. And those who have certain genetic predisposition towards negative effects of estrogen, such as if you have an extensive family history of breast cancer and they've BRCA gene mutation positive, it may be best to avoid estrogen. Also in the population 35 plus, especially those who smoke, estrogen can increase risk for blood clots, and so that individual might benefit from progesterone only. What are the side effects? I just want to say really quick that oftentimes patients will read a list of side effects and think, I don't want all that, and none of us do. It's important to realize that the number of patients who experience side effects are a small subset. Occasionally we erroneously perceive that we're going to get all those symptoms, and so It'd be very rare for an individual to get all these symptoms, and the majority do quite well, but they can cause the following. They can contribute to weight gain, oftentimes first by increasing appetite. For some, it can decrease their interest in intimacy. For others, it can worsen, but others, it can improve their skin conditions such as acne. Many can experience some transient nausea, oftentimes when it's first initiated. It can also result in some mood changes such as depression, anxiety, for some hair growth. And lastly, even though for many it will help to regulate their cycles and cause more regular periods, it can cause some irregular spotting for some. That's just an old slide that shows you how the birth control pills might come. Basically, you take it for 3 weeks on and then 1 week off, although there's different formulas nowadays where you can go 3 months in a row just skipping the placebo or the period week, and so you're only having a menstrual cycle every 90 days. That's safe and okay to do, and oftentimes can be beneficial for certain individuals with underlying medical problems such as endometriosis. Who should not take birth control pills? I'm not going to read every point here, but those who might have these susceptible conditions. DepoShot is another option. Historically, this was quite popular in the 90s and early 2000s before we had some additional options. The benefit is for those who have busy lives and may forget to take a pill every day, which is an important part of responsibly taking oral contraceptive pills. If your life is such that you're probably going to forget more days than not, the birth control pill is not the greatest way to go for you. And so the DepoShot, a lot of people get really nervous about the needle, but most who choose this family planning measure are quite pleasantly surprised to realize that the discomfort is pretty small. So it's a shot usually given the outer arm once every 3 months. It slowly releases what's referred to as medroxyprogesterone, a type of progesterone only that's slowly released in your system for greater than 90 days. So benefits, you don't have to take a pill daily. It also, like the birth control pill, can cause an array of potential side effects. Probably the biggest that I see in my own practice is for some, it can stop their periods, which is oftentimes a pleasant side effect, but for others it can cause some irregular spotting, at least initially. Why? Because progesterone thins the uterine lining, but that's safe and okay to do. Others, the other big side effect that I see is for some it can increase appetite and contribute to weight gain. But for those who are really proactive in anticipating that appetite increase and have measures such as eating carrots and celery instead of the non-nutritional carbohydrates, I usually see less weight gain associated with that. The vaginal removal ring, what this form of birth control provides is a different delivery mechanism to provide estrogen, progesterone to inhibit ovulation. The benefits of this, as you can see from the following slide, is it's a small collapsible ring, looks like the little bracelets my little girls used to get in the 25-cent machines at checkout at the grocery store, but it squeezes and you can insert it inside the vaginal tract yourself, much like a tampon. It stays in there in most cases for 3 weeks, and then you take it out the week of your cycle, and then if you're doing the monthly prescription, you would replace it with a new one. If there's actually now an annual prescription where you can just wash it and replace. If it were to come out during intimacy or other times, you just wash it with warm water and replace within 3 hours. So this, also like the DepoShot, is beneficial for individuals who may have a difficult time taking pills every day or otherwise have side effects. This is still systemic, where the hormones can go throughout your body, but oftentimes better tolerated for some who might otherwise be hormonally sensitive than the pill. The transdermal patch, not as popular now as it was 10, 15 years ago, but still an option for many. It's a patch that has both estrogen, progesterone that can be applied to the body, and it's kept on the body in one particular spot for a week at a time. And so you put it on once a week for 3 weeks, and then you don't remove it for a week while you have your regular menstrual cycle, and then replace. It received a little bad press just because the estrogen, and if people put it too close to breast tissue, there was some concern for those who had risk for estrogen receptor breast cancer, that it may increase that possibility. That's still being studied, but I think that was one of the negatives. But for some, they really still enjoy this form of birth control. The next one on is somewhat newer to the market. The way this device works is it's an implant. Sounds all robotic and sci-fi, but it's actually pretty minimally invasive compared to other options. Let me show you. And so that picture shows what the Nexplanon looks like on the outside of the arm. Through an office procedure, we use a little anesthetic spray. At least in my office, we use a little anesthetic spray, put a little local anesthetic, and then prep the skin to prevent infection and gently introduce that underneath. Most of my patients say the discomfort levels is 0 or 1 out of 10. easy to insert. There'll be a little bruising and tenderness afterwards, and then that device will slowly release hormone for the next 3 years. One of the most effective, most of these are in the 90s as far as effectiveness. This is touted to be 99% plus. And so a lot of patients really like that because they're not having to change something out every week or month. They're not having to take a pill daily. They're not having to get a shot once every 90 days, and it's good for up to 3 years. Side effects, the package insert kind of downplays the vaginal bleeding. In my own experience, it may be a little bit more present than less than 5%. I might see up to 20, 30% who can have some irregular bleeding at first. That seems to be the biggest side effect. And then like the other forms of contraception, you can see some transient nausea, mood changes, or headaches, but many patients are really happy with it. And especially like, it may not sound like less invasive, but compared to the next one we're gonna talk about, it really seems to be. One thing I haven't mentioned yet is that when you desire to have a family, oftentimes it's beneficial to have the next splint on or even stop the Depo-Provera well in advance, probably at least 3 months before you want to start trying on a family, as it can take a little time for your body to self-regulate and get back. With the Depo-Provera shot, as previously discussed, it can sometimes take up to a year for your body to fully get back to normal. These do not cause infertility, however. And lastly, the intrauterine device. This is personally one of my favorites, not because I get any kind of kickbacks from the manufacturers, but rather just based on patient success and how it works. The way this device works, as this cartoon picture can show, it's gently inserted through an office procedure past the cervical opening, goes in as a rod, and then the arms expand. I wish I had an example. I think you can see in that top right, somebody holding it in their finger and thumb to show how small it is. But it's gently inserted into the uterus, and it can work for, there's one version that's good for 3 years, there's 3 versions that are good for 5 years, and there's one that's good for greater than 10. And so the mechanism of action of this device is the majority of the different devices solely release progesterone. They're estrogen free. One of my favorite things about it, especially for my patients, which might have more a history of hormonal sensitivity, is it slowly releases and it just stays within the female genital, the gynecologic area of the uterus and those structures. 85% stays there. Only 15% is released systemically throughout the body, significantly reducing the risk of other symptoms. For a lot of patients, it can help to slow down their cycles. It can make them more regular, lighter. It's been shown to significantly reduce the risk of women having to get an endometrial ablation or hysterectomy. Some insurance plans in the Mountain West actually require patients to receive a trial of an ID before they get a hysterectomy. So for the population closer to my age, it's beneficial for them. For those much younger in the reproductive area of life, it's nice that they don't have to think about it, less hormonal sensitivity. The biggest risk is there can be some discomfort with placement. But if you have, go to see a provider who's had experience with placing many of these, oftentimes they've learned techniques along the way that can help to make that a less scary and a more comfortable process. And so we talked about the advantages, we talked about disadvantages. Most will have lighter cycles, but for some there could be some irregular and heavy bleeding. But I'd say in my experience, that's the rarity and not the norm. And this slide just shows us perhaps what's the most effective form of birth control of all, but not as readily available. Thank you for joining us for this educational content video. If there are other questions, concerns you have, we invite you to talk to your healthcare provider. If you don't yet have one, we're happy to address questions and concerns that you might have. Thank you.